Dr. Legge, back to you then. What are ways then that post-DBS that you are looking for to see how successful, if you can determine the success of it, how do you counsel your patients going forward after a thing like that?
When we look at the studies, easily over 90% of patients that have deep brain stimulation done when you've gone through a good patient candidacy selection and had that well choreographed, outcomes are generally quite positive, and 90% of patients indicate they would have the deep brain stimulation done again, because it does help such significant quality of life symptoms. Again, with the motor symptoms, in particular, patients that have tremor do the best with deep brain stimulation. So we generally do see a lot of reduction in what we call off time. That is when that carbidopa-levodopa is not working and there's more symptom time throughout the day with tremors or stiffness or slowness. We see that go down significantly with deep brain stimulation. Dyskinesias can decrease on the order of 50 to 75%. And we can decrease medication, sometimes that magnitude as well, by 50 plus, 70 plus percent. Because at that point, the pacemaker is controlling a lot of the symptoms instead of the medication. So you're able to reduce the amount of pills, and by doing that, you're reducing a lot of the systemic side effects. So if the carbidopa-levodopa is causing constipation or dry mouth, we see a lot of alleviation of those symptoms, which is very exciting. And but as Dr. Shields was indicating, this process of honing in on the patient's best setting it can take a few months to really zero in on that. But it's an exciting time for patients. A little bit of trial and error as we get going down that runway, but eventually we take off.